Navigating a cancer diagnosis and its treatment can be overwhelming. Understanding your medication is a crucial step in managing your health. Today, we'll explore Imbruvica, a targeted therapy that offers hope for many patients. Imbruvica, known by its generic name Ibrutinib, is a powerful oral medication. It belongs to a class of drugs called BTK inhibitors, which are a type of targeted therapy. Unlike traditional chemotherapy, Imbruvica works in a very specific way. This medication is available in capsule, tablet, and oral suspension forms. It is taken once daily, making it a convenient option for many patients. Imbruvica was first approved by the FDA in 2013. Imbruvica functions by targeting and blocking an enzyme called Bruton Tyrosine Kinase, BTK. BTK acts as a signal for certain cancer cells, telling them to grow and divide uncontrollably. By inhibiting BTK, Imbruvica stops these cancer cells from multiplying. This targeted action also triggers these malignant cells to die, helping to slow the progression of your disease. It's a precise approach that aims to minimize harm to healthy cells. Imbruvica is FDA approved for several specific conditions in adults. These include chronic lymphocytic leukemia, CLL, and small lymphocytic lymphoma, SLL, even in cases with a 17p deletion. It also treats Waldenstrom's macroglobulinemia, WM. Additionally, Imbruvica is approved for chronic graft-versus-host disease, CGVHD, in patients aged 1 year and older after other treatments have failed. Please note, it is no longer indicated for mantle cell lymphoma, MCL, or marginal zone lymphoma, MZL. For CLL/SLL, Imbruvica can be used as a first-line treatment or after previous therapies. It can be taken alone or in combination with other drugs like Gazyva, obinutuzumab, or rituximab. Clinical trials have shown significant improvements in survival and progression-free survival for CLL/SLL patients. Like all medications, Imbruvica can cause side effects. Common ones occurring in 10% or more of patients include diarrhea, bruising, and upper respiratory tract infections. You might also experience fatigue, musculoskeletal pain, or a rash. Other common side effects can be fever, joint pain, constipation, and sinusitis. Swelling of extremities, dizziness, nausea, and mouth ulcers are also possible. Your healthcare provider will monitor your blood tests regularly, as abnormalities like decreased platelets, neutrophils, and hemoglobin levels can occur. It's crucial to be aware of potential serious side effects. Seek emergency medical help immediately if you experience signs of an allergic reaction, such as hives, difficulty breathing, or swelling of your face, lips, tongue, or throat. Imbruvica can increase the risk of serious bleeding, including internal bleeding. Watch for signs like dizziness, confusion, black or bloody stools, or coughing up blood. Your doctor may temporarily stop your medication before and after surgery. Infections are another serious concern, as Imbruvica affects your immune system. Serious bacterial, viral, or fungal infections have been reported. Tell your doctor if you have a fever, chills, cough, or mouth sores. Rare but severe infections like progressive multifocal leukoencephalopathy, PML, can occur. Heart problems, including irregular heartbeats like atrial fibrillation, heart failure, and even sudden death, have been reported. Report symptoms like palpitations, dizziness, or shortness of breath to your doctor right away. High blood pressure is also a risk, so your blood pressure will be monitored regularly. Blood count abnormalities, such as low white blood cells, platelets, or red blood cells, are possible. Your doctor will perform regular blood tests to check these levels. Treatment may be adjusted if these counts become too low. There's an increased risk of developing other cancers, particularly non-melanoma skin cancer. Discuss this risk with your doctor and protect your skin from the sun. Tumor lysis syndrome, TLS, characterized by nausea, vomiting, and muscle cramps, has also been reported. Before starting Imbruvica, it's vital to share your complete medical history with your doctor. Inform them if you have ever had an infection, bleeding problems, or a heart rhythm disorder. Also, mention any risk factors for heart disease, such as diabetes or high blood pressure. Tell your doctor if you have low blood cell counts or liver disease. If you are planning surgery or any medical or dental procedure, inform your healthcare providers. This helps ensure Imbruvica is safe and appropriate for you. Imbruvica can harm an unborn baby. If you are a woman of childbearing potential, you will need a pregnancy test before starting treatment. Use effective birth control during treatment and for at least 1 month after your last dose. Men should also use birth control if their partner can become pregnant, continuing for 1 month after the last dose. If pregnancy occurs, tell your doctor immediately. Do not breastfeed while using Imbruvica and for at least 1 week after your last dose. Always take Imbruvica exactly as prescribed by your doctor. Follow all directions on your prescription label and read any medication guides provided. Take your medicine with a full glass of water at the same time each day. Swallow tablets or capsules whole. Do not crush, chew, break, or open them. If using the oral suspension, shake it well and measure your dose with the provided device. Drink plenty of liquids while on this medication. If you miss a dose, take it on the same day you remember. Then take your next dose at the regular time. Do not take 2 doses on the same day. In case of an overdose, seek emergency medical attention immediately. Certain foods and medications can interact with Imbruvica. Avoid grapefruit and Seville oranges, including grapefruit juice and orange marmalades, as they can increase side effects. Tell your doctor about all other medicines you use, including prescription, over-the-counter drugs, vitamins, and herbal products. Specifically, inform them if you are taking moderate to strong CYP3A inhibitors or inducers, as these can affect Imbruvica's effectiveness or increase side effects. Your doctor will advise you on necessary adjustments. Store Imbruvica capsules and tablets in their original container at room temperature away from moisture and heat. The oral suspension can be stored at room temperature or in the refrigerator, but do not freeze it. Discard any opened oral suspension after 60 days. Imbruvica is manufactured by Janssen Biotech Inc. and Pharmacyclics LLC. Always keep medications out of reach of children. The cost of Imbruvica can vary. According to price guides, a supply of 28 tablets can be significant. Prices are for cash-paying customers and may not reflect insurance coverage. For eligible patients, copay cards and patient assistance programs may help reduce out-of-pocket costs. You can often find information on how to apply for these programs on the Imbruvica website or through drug information resources.